Good day, this is Professor Will, CBMD PhD, and today is Wednesday, September 29th, 2021, and it's 5:16 and 27 seconds, p.m. Eastern Standard Time. In today's research, risk of aneurysms, so let's hop to it here. Research scientists find vital link to identify people at risk of aneurysms. Date September 29, 2021. Source, University of South Australia. A new study has measured a link between variations in size of the brain's arteries and the likelihood of a cerebral aneurysm, providing scientists with a new screening tool to monitor people at risk. It is a silent killer. Warnings are rare, but to the million people who suffer a ruptured brain aneurysm each year, almost half will die, and only a third will recover without disabilities. Researchers say imaging tests of 145 patients showed that people with asymmetric brain arteries have a significantly higher chance of developing an aneurysm, a balloon vessel in the brain that can rupture and cause hemorrhagic stroke. A subarachnoid hemorrhage is the most dangerous type of stroke and occurs when the brain aneurysm leaks or ruptures, causing bleeding into the brain, killing more than 50% of infected people. A lot of small unruptured aneurysms go undetected and commonly use imaging techniques. They may not be diagnosed until they grow sufficiently to cause symptoms or rupture, often when it is too late. Researchers looked at brain images of people with aneurysms and found that the four arteries entering the brain box, dividing into multiple segments and supplying blood to the brain, were not in proportion to each other, thus increasing peaks in blood pressure and predisposing them to balloon blood vessels. Where the front part of the brain arterial network, the anterior cerebral artery, or A1, differs in left and right diameter ratio by up to 1.4, and people have an 80% risk of developing aneurysms in that region, the most common location of ruptured aneurysms. Those with symmetrical ratios below 1.4 have a 7.8% equivalent risk. The cerebral aneurysms cause almost 500,000 deaths worldwide each year, half of them occurring in people under the age of 50, with women at greater risk. The main symptom of a burst aneurysm is a sudden severe headache, often accompanied by double vision, nausea, and vomiting, a stiff neck, muscle weakness, confusion, seizures, and cardiac arrest. And if detected early, aneurysms can be monitored and slowed by controlling blood pressure with medication and diet and lifestyle changes. They can also be surgically clipped or removed, but this also carries risk of brain damage or stroke. It is only recommended if there is a high risk of rupture. Based on research findings, MRI and CT angiograms will determine whether people have asymmetric brain arteries, and if so, they should be screened regularly for cerebral aneurysms. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have an awesome day.